Hello dear students, today we are going to see in daily drug concept a new drug called the imipramine. Okay, have you heard about imipramine? No? This drug belongs to the category of the antidepressants. Okay, so let's know more about the imipramine. It is indicated for the treatment of the depression and to reduce the childhood enuresis. Okay, what do you mean by childhood enuresis? Childhood enuresis means the bedwetting. Some kid has the ability by the age of 5, 6, 7, they wet their bed while sleeping. So this drug can be given. This is the only drug which is approved for this indication, that is childhood enuresis, and it is also used in the treatment of depression. Okay, it is available in the form of tablet and the capsule. The doses may vary from 25 mg to 200 mg per day depending on the severity of the and the patient condition. Okay, it is contraindicated if the hypersensitivity to the imipramine is already being known to the person. It also in the acute porphyria. What do you mean by acute porphyria? When there is the any enzymatic problem in the formation of a heme, it is called as the acute porphyria. So anybody which has this problem of formation of the heme, then this drug imipramine is contraindicated in such cases. It is also contraindicated in the case of hepatic impairment, any impairment related to liver, cardiovascular diseases and the urinary retention, etc. Okay, the side effect associated with the imipramine are the drowsiness, weakness, tiredness, dry mouth, difficulty in urinating and frequent urination. So these are the side effects mostly available with the imipramine, but the concentration is very low. That this can happen to the 1 in 1000 patient. Okay, the brand name in the market available with the imipramine are Tofranil, this is a very famous brand, Depsol, Depsonil, Antidep, Depranil, Elamin, etc. This drug is given in the treatment of depression, though this has to be prescribed by the doctor. So this drug belongs to the Schedule H drug. Okay, now we'll see how this imipramine works. Its mode of action we are going to see. It binds to the sodium dependent serotonin and non-adrenaline transporter. Okay, what imipramine does? It binds to the sodium dependent serotonin and non-adrenaline transporter. First of all, you tell me what is serotonin and non-adrenaline do? They are called as the happy hormones. Okay, so these hormones, they keep oneself very happy. The eager of having good food, the good mood can be maintained by these hormones. Okay, the serotonin is one of them. So this drug acts on the sodium dependent transporter. What it does? It reduces the reuptake of the non-adrenaline. It reduces the reuptake of the non-adrenaline, so that the level of adrenaline and serotonin will increased in the human body, and what your mood will also increase. The patient's mood will also increase. His appetite or her appetite may also increase. So their happy mood can be maintained if this drug will bind to the sodium dependent channel. Okay, and thus elevating the level of these neurotransmitter in the brain. So what this serotonin and noradrenaline, this level can be elevated in the brain so that all depression can be healed. And how it works for the bedwetting? In bedwetting, it is worked by showing its anticholinergic activity. By this anticholinergic activity, what will do? It will reduces the bladder contraction. So the frequency of urination will be decreased. automatically. So imipramine is given in two cases. First of all, it is given for the depression patient and for the kids who are having the habit of tendency of the bed wetting. I hope you have understood the mode of action and everything about the imipramine. Thank you so much. This is all about. Thanks.